Thank you so much for the introduction. Good afternoon, everyone. My name is Victoria. I'm a current PGY3 resident at the Harvard Combined Dermatology Residency Training Program. This is my first ASLMS, and I'm very excited to be here with y'all, and I'm even more excited to present a case report that I authored alongside my wonderful continuity mentor, Dr. Sandy Tsao, entitled The Novel Treatment of Vulvar Acne Keloidalis with 755 nanometer Alexandrite Laser. So quickly, we're going to go through the case presentation in the very short 5 minutes that we have. We'll jump into the conclusion, and then I will touch on a couple of acknowledgements too. So hopping right in, we have a 16-year-old female with a past medical history of autism spectrum disorder, as well as anxiety, who presents alongside her mother, given a chief complaint of recalcitrant and exceedingly painful vulvar lesions for about 4 years or so. Notably, she had already been seen on numerous occasions by medical dermatology before making her way to us in the cosmetic center. She had also failed treatments including oral Bactrim, oral Keflex, as well as topical corticosteroids. On the physical exam, as you can appreciate right here on the right-hand side of the slide, she does have Fitzpatrick skin type 2, and on a background of black, coarse, curly terminal hair, you can appreciate mammulated clusters of firm but friable papules over the superior aspect of the vulva, with an adjacent focally violaceous plaque, as well as some sparse erosions with hemorrhagic crusting. Now, taking this into consideration alongside her existing medical comorbidities, we had a pretty in-depth discussion with her mom, and it was determined that in order to optimize patient comfort, we'd proceed with biopsy under sedation in our operating room. For the biopsy, we took 3 4-millimeter punch biopsies, 1 to make sure that there was no form of cutaneous malignancy, and 2 to make sure that there were no brewing infectious processes that we could have been missing. For this reason, one of the specimens was sent for tissue culture at our microbiology lab. And when we got the histology back, we were able to appreciate acute and chronic inflammation and a background of dermal fibrosis and vascular proliferation. Notably, the changes were not supportive of any form of a neoplastic process, and all of our stains resulted negative for infection, as did the tissue culture when it came back. And when we took this into consideration with the physical exam findings that we saw, we were able to cinch a diagnosis of acne keloidalis for this patient. Now, moving into acne keloidalis and the treatment options that exist, classically, it presents as chronic inflammation of the hair follicle unit, resulting in keloid-like scarring as well as cicatricial alopecia. Most notably, this is most often appreciated in the occipital scalp region of patients, male patients to be exact, with Fitzpatrick skin type 4 through 6. Treatment options include, but are not limited to, decreasing friction, as well as antimicrobial cleansers, oral tetracyclines, intralesional steroid injections, oral vitamin A derivatives, and what we are all here to talk about today, laser-assisted hair reduction. Our patient has done phenomenally well. She is status post treatment number 4, most recently in February of this current year with our 755 nanometer Alexandrite laser. The settings are listed below, and I would just like to say that the patient is significantly more comfortable now. Mom is ecstatic, and we are just honored to have been a part of her care. Notably, this was also performed in the operating room under sedation for her comfort. So, in conclusion, the long-pulsed Alexandrite laser has demonstrated efficacy in the treatment of acne keloidalis nuchae lesions, and herein we present a novel case of efficacious and minimally invasive treatment of acne keloidalis of the mons pubis as well as the labia majora with long-pulsed 755 nanometer Alexandrite laser. Thank you so much for your time and attention. I love the background music. It makes me feel like I'm back in high school cheerleading. I would just like to give some acknowledgments to the absolute best continuity mentor, Dr. Sandy Tsao, as well as my residency training program and the MGH Department of Dermatology and Laser and Cosmetic Center. Thank you so much.